I'd like to welcome everybody out to the ribbon cutting for our Hy-Vee convenience care clinics. My name is Mitch Wasden. I'm the Chief Executive Officer and Chief Operating Officer of MU Healthcare. We have several people who will be speaking with you today. We've got joining me here on the podium is Dr. Hal Williamson, also, who is our Vice Chancellor at the University for all the health sciences. The idea for convenience care clinics actually started about 2 years ago with the university. We were looking for a partner to offer convenient and affordable health care so that people could come in without an appointment and be seen for various conditions. And we reached out to Hy-Vee because they have such a great reputation for health and wellness of the people that use the Hy-Vee supermarkets. And we had a long series of about 18 months of planning, recruiting staff, building out the facility. And so we're excited today to be doing the ribbon cutting and opening 3 locations. One here on Nifong, and then there will be one at the Broadway location and one at the Connolly location, all being open this week. The clinics will run hours of 7 a.m. to 7 p.m. Monday through Friday, and 8 to 4 on the weekends. And so we think we've given a great broad range of service for our patients. One of the things that we're excited as well to have as a partner is our own Department of Family and Community Medicine. A lot of people don't know this, but our Department of Family and Community Medicine has been ranked in the top 10 of family medicine departments in U.S. News and World Report for over 21 consecutive years. And so, so one of the people that we've partnered with quite a bit in family and community medicine is Dr. Zweig and Dr. Lefevre and Dr. Pereira, all of whom have a different role in the opening of these clinics. Dr. Pereira is going to have a very hands-on operational role in the clinics. Dr. Zweig is the head of our family and community medicine program. And then Dr. Lefevre, who's going to be speaking after me, is actually on the U.S. Preventative Health Task Force. He's one of 3 physicians who's on that task force and has provided a lot of thought leadership in a lot of the things that we do in family and community medicine. So at this time, I'd like to turn the time over to Dr. Lefevre, and he'll leave us with a few words.
Thanks, Mitch. We're delighted to be here tonight to help celebrate the opening of these Mizzou Quick Care clinics. Thank you. I won't touch it again, I promise. I've been a family physician for 30, I have to say, plus years. I appreciate that healthcare has changed and healthcare consumers have changed. They're far more engaged and actively participating in their healthcare needs today than they were 25 to 30 years ago. And one of the things that they're looking for are options, choice in how to meet their healthcare needs. We also recognize that consumers are looking for convenient, cost-effective ways to meet their healthcare needs, and that's why we're here to celebrate the opening of the Mizzou Quick Care clinics, which really represent a step forward in our care to mid-Missouri. The clinics, as Mitch said, are going to be open 7 days a week, 7 a.m. to 7 p.m. and 8 a.m. to 4 p.m. on Saturday and Sunday. The clinics will be staffed by experienced healthcare providers, nurse practitioners, and physician's assistants. Anyone 2 years or older can be treated here, and the emphasis really is on getting people out and having convenient, affordable access for common everyday problems that people need help with. Conditions that really do need care, but really don't need a trip to the emergency room, and for which people are looking to say, get in, get out, and get well. We've designed the clinics to take care of common, for example, upper respiratory symptoms, sore throat, earache, cough, pink eye, urinary symptoms, common rashes, minor injuries, and actually common work physicals and sports physicals can be accomplished here at our clinics. At this point, you may be wondering, well, why here? Why Mizzou Quick Care? And I actually think that one of the biggest differences between these clinics and other potential options for these types of illnesses is that these clinics are not isolated from the rest of your healthcare needs. This is really the front door to MU Healthcare, a very large healthcare system, and 500 doctors of all specialists. And an important part of these are an important part of Missouri's academic medical center. For patients who already see one of our excellent physicians in primary care, in family medicine, internal medicine, or pediatrics, with our advanced electronic medical record, the information that you need will be there when you see the clinicians here and you go back to your primary care physicians. The information is right there for them to have. For those who do not have a primary care physician and need follow-up or are just looking to establish care with a primary care physician, we will find that person for you. And we will schedule an appointment. Patients will always be better served when the provider you are seeing knows what has happened with other providers. And MU Healthcare is actually proud to be a national leader in the use of advanced information technology in healthcare. And for you, that means that the medical record in Quick Care clinics is integrated into our overall electronic record. When you're seen here, the providers can easily access any care that you've received anywhere in the MU healthcare system. And in the opposite way, after you've been seen here, if you're seen anywhere in the MU healthcare system, they will have access to your information. Our primary care physicians do understand the importance of continuity of care, but we also understand there are some simple health problems where convenience and time are probably the most important factors, and we are here to serve. We are committed to the right care at the right time and for those that we serve. As Mitch noted, the Quick Care clinics are managed by MU Healthcare and the MU School of Medicine's Department of Family and Community Medicine. So with that, I would have the pleasure of introducing my colleague in the department, Dr. Stephen Zweig. Dr. Zweig is the chair in the Department of Family and Community Medicine, has been extremely involved in this project, and he's going to tell us some more about the mission and focus at these clinics and how it ties back to MU Healthcare's mission. Steve?
Thanks, Dr. Lefevre, and thank everyone for coming out tonight. And I just want to recognize a few other people, Dr. Susan Pereira, who's the medical director, Phil Vineyard, who's in the back, who's been the manager, and all of these people in front who are patient service representatives, physician's assistants, and nurse practitioners who are going to be working in these practices. And each of them have worked very hard to get these clinics up and running, and we're really very proud of them. So primary care physicians like me, Lefevre, Williamson, Pereira, we all know that good access is really an important piece of the work that we do and can help all of our patients live better lives and be hopefully free of disability and be able to do the things that they want to do. So we want these clinics to be a gateway for patients, an entrance point to our health system, but also access for our existing patients. One of the things that we strive to achieve in primary care is to create a medical home, a place where patients can count on to get the care that they need to help their care be coordinated, even during times when things seem complicated and confusing, and to provide good access for people. Having a medical home ensures that the patient remains at the front of all the work that we do. And as Dr. Lefevre emphasized, we hope that every patient will have a medical home and with a team of professionals who will help to coordinate all of their care needs. I do want to stress, however, that these quick care clinics are available to everyone, whether or not you already have a primary care physician. And in closing, I'd really like to thank the many people who have joined us today, the people in the health system, all the others who have helped to advance our goal of improving the health of Missourians. And I especially want to thank Hy-Vee, a company who shares our mission in trying to help people meet their health and wellness goals. And I want to recognize the faculty and staff of Family and Community Medicine for their outstanding efforts, all of whom helped us to achieve the sort of national stature that Mr. Wasden mentioned. So now I'd like to introduce our last speaker, and that is Mr. Matt Off, who is the store manager here at Hy-Vee, to talk more about this. Thanks, Matt.
Well, good afternoon. Obviously, this is a pretty exciting day for us, and on behalf of the other two store managers who are in the back of the room, we're excited about our partnership with the university. This is going to provide just another opportunity for our customers to simplify their lives. One of our platforms for our company is health and wellness, and I couldn't think of a better way to exercise that than with this clinic. It gives us the opportunity to partner with a world-class medical provider and also use our expertise in health market, pharmacy, and all three stores have an in-store dietitian as well. And we can really provide the whole health message for our consumer. Making lives easier, healthier, and happier is our company's mission, and I think this is going to do exactly that. So thank you for coming.
Okay, at this time, I'd like to thank everybody who has addressed us. If we could now get all of the chamber ambassadors and everybody here up over to our ribbon there. We're going to do a ribbon cutting.
Let's open this clinic. Smile, cut.
Cut.
Cut. There.